Dr. Rafich here from Vet Triage. We are continuing on with this issue of JAVMA from May 2014. What is your diagnosis? There it is. We've got a 12-year-old male-neutered Labrador Retriever, bleeding from the right hind limb paw, non-weight bearing lameness, moderate swelling, pain associated with the second digit, small amount of purulent discharge, thickened and brittle nail growing out straight instead of curved. And this has been going on for the past year, but acute on chronic onset. They performed thoracic radiographs and basic blood work, which was normal. This study comes out of a hospital in Colorado, as well as the Ohio State University Vet School. On radiographs, which I have here, you can see in this area, there is an expansile lysis of the ungular crest of the third phalanx of the second digit, with smooth margins and extensive lysis of the third phalanx. There you go. The soft tissue swelling adjacent to the lytic area of the second digit is present. So osteomyelitis, either fungal or bacterial, or intraosseous epidermoid cysts were considered. Otherwise, cancer was the main differential. They performed the amputation of the second digit of the right pelvic limb at the level of the metatarsophalangeal joint. A completely excised keratoacanthoma was diagnosed. So, discussion. Osteolysis can be seen in both benign and malignant disease as well as infections. The most common subungual tumors in dogs are squamous cell carcinoma, malignant melanoma, osteosarcoma, soft tissue sarcoma, and mast cell tumor. Subungual neoplasia is generally considered locally invasive, resulting in a swollen ulcerative appearance to the affected digit. The toenail may be split or broken. Subungual keratoacanthoma is a benign tumor seen with the nail bed. The tumor is composed of well-circumscribed eosinophilic keratinocytes that do not extend through the basal lamina, as is seen with squamous cell carcinoma. Areas of parakeratin are also observed. Subungual keratoacanthoma is not the same as intracutaneous cornifying epithelioma, which is also known as a keratoacanthoma, but arises from the superficial epithelium between hair follicles. The nail is often enlarged and rarely lost during the course of disease. Tumor-induced lysis of the nail bed results in loss of the distal phalanx. Pressure necrosis within the toenail can cause bone resorption. However, these tumors are slow-growing and considered benign. Amputation is curative. Disarticulation and amputation at the level of the metacarpophalangeal, metatarsophalangeal, or proximal interphalangeal joint is recommended. This is both for diagnosis and for treatment. So in general, because that's it, that's the case. They don't show, again, the actual tumor when they removed it from surgery or any histopathologic images. But as far as client communication goes, even though it may seem like a benign process for a surgeon to remove the digit of a dog, and we know that dogs don't really care about cosmetics, and we know that removal of a digit on the side of the paw as opposed to one or both of the central digits don't really mean much for weight bearing. They don't mean anything for weight bearing. The dog should still ambulate normally. Presenting the idea of digit amputation to a pet owner is going to be a shock. It still is a scary idea because if you think about losing your own toe or finger, it's a big deal. Whereas, and so people then personify that, they apply those feelings to the dog. So make sure when you talk to a pet owner about digit amputation, you have to emphasize the benefits of it greatly outweigh in general the risks of it. And in a situation like this where you're dealing with, even though it's a benign cancer, it is causing bone loss and swelling and infection and pain and lameness. And so it's worth it, especially considering it's going to be curative. So I probably would remove this tumor up to this joint right here is where I would go. And and it would cosmetically, it would look good once it all heals up, and the dog won't know the difference with that. So make sure that you stage these owners correctly for the emotional impact it's going to have to them. You have to treat it with the same level of consideration as you would a entire limb amputation, right? Which is obviously even a scarier thing, but for people, for their dogs, any amputation is a big deal. So make sure you handle that conversation with care. All right, thanks for supporting the channel. We'll see you again tomorrow. Bye-bye.